So our first speaker today is Dr. Graham Brown. He is a Senior Research Fellow from the Australian Research Centre in Sex, Health and Society at Trobe University, and he will be talking about the role of peer insights in harm reduction programs and policies for people who inject drugs.
Great, thanks Sam. Okay. Some of you will be familiar with some of the work that I've been doing in this project called What Works and Why. But for those that are less familiar, one of the things I'd like you to sort of bring back into your mind is a couple of the presentations this morning, particularly with Martin and Margaret's presentations, about the idea that in both HIV and Hep C, but also B and STIs, but particularly HIV and Hep C, we're working with a very rapidly changing environment, and it's going to be difficult to predict how things are really going to play out. So our connections and engagement with the communities we're working with and the need for that kind of real-time knowledge and information of what's happening right now in communities is going to be absolutely critical during those sort of times. So that's part of the background as to why this project was developed. A couple of things to consider is peer-based programs in HIV and Hep C, so that's peer education, peer-led programs, peer leadership, peer service delivery, a whole range of things, not all clearly defined, but that area and that approach has underpinned the partnership approach that we've had in Australia for a long time. But there's a really complex relationship between investing in these sort of community-driven programs and the actual outcomes that we're achieving. And so in that sense, what's difficult is because the programs themselves and the peer programs are inextricably linked to the sorts of changes that are happening in our communities. So what makes investment in one peer program is quite compared to another is quite difficult to work out. And one of the key things that we felt was problematic in that was the very way that often we talk about and articulate peer programs as opposed to how they actually run in the real world. So what we wanted to do was develop a more sophisticated or a better understanding of how peer programs actually work so that we could work out a better way of monitoring and evaluating them. What I really mean by that is a better way that our peer and community programs can demonstrate what they're actually achieving and what their role is within the overall response. So we wanted to develop a more sophisticated understanding of how peer programs worked, help our peer programs evaluate what actually matters to their work, and articulate how peer-based programs add value. We did this with a whole range of programs. We mainly focused in HIV and Hep C, particularly because we felt they were two areas that had probably the deepest and longest understanding of peer programs within the STI and BBV area. So we worked with a whole range of collaborators I've noted there, including in Western Australia, the WA Substance Users Association. Now what we did was, in a way, ignore what the programs were funded to do and why they'd been contracted and so forth, and really sit down with people who've been working in these programs with a huge amount of experience and expertise of working within these communities in peer programs, and kind of try and pull out all the mental models, the ways they understand of how they work. Now, if you can imagine, that means working not only, say, with outreach staff, community development staff, campaign staff, board members, volunteers, that whole aspect. While all of those people may be peers, they've all got a kind of different part of the picture of what actually happens and how the programs work. And what we generally find is it's pretty rare to actually try and bring all of those pictures together. So we went through a whole lot of activities and workshops, and there was many forests killed with butcher's paper and post-it notes and so forth, to really try and bring all that together and develop what we refer to as system maps. And some of you will be familiar with some of the evolving language around systems thinking or systems science. But really what we're talking about is trying to understand the program in the context of like an ecological map of everything that it relates to and the rest of the public health system, the changes in community and so forth. Trying to get a picture of that rather than just the program by itself. So we developed a whole lot of maps showing how the interventions are embedded and engaged in both their communities and the complexity of, state, Commonwealth relations and so forth, all of that as systems. And then what we needed to do was identify what some of the key functions were and how they related to each other to then work out some real indicators. So what I mean by all that is instead of thinking of the peer programs, say some of the work we did with WASWA around recruit peers, they'll go and engage community and provide service which will magically influence the entire community, and we will improve testing and harm reduction. Quite simple, each one will lead to the next. Now that's often how they're kind of contracted, funded and evaluated. Through this process, what we know is if we actually mapped what was going on, it would look a bit more like something that I've broken. Okay. It would look more like that. Okay. That's what I mean by system map. Now, you don't have to understand that, and I'm not going to take you through it. If you think for the project, if you think of this map the same way as in a research report, you might look at a whole table of numbers, some sort of epidemiological report. It's the same kind of thing, okay? Means a lot to the person who put the table together, okay, but not a lot to anyone else. Now what we did is we worked with these across a whole range of programs. So this is one we worked with WASWA around injecting drug use and NSPs and so on. There was one around people, sex work and gay men and so forth. I'll just jump back a bit. What we needed to do though was step back from these and go, okay, that's great. And from this, we pulled out a lot of very important strategic insights for the programs themselves. But what we wanted to get was something that we could transfer and move across so that other peer programs generally could get a sense of what we're actually finding. So we compared all the different programs, these system maps, and thought, okay, there seemed to be 4 key functions that were going on. I'll take you through them quickly. One we called engagement. So this was, and what I mean by functions, I don't mean necessarily functions of the program, but things that needed to be happening in the system that the program was operating in for it to reach its full potential. So one of the things was how the program maintains up-to-date mental models, the diversity and dynamism of its community. And what we're really tapping into there is that unique aspect of peer programs. It's not just the engagement they have through service delivery and outreach, but it's also the fact that peer programs are drawing people from the community to work in the programs who are still living and operating and living within those communities. So it's as much about their networks as it is about the services networks and all the other ways that a community-based program engages and understands its community. Alignment was how the program or the peer program picks up signals about what's actually happening in its policy sector environment. So what other services are doing, what changes they're doing to also accommodate the changes that are happening in the community, and how well does the program actually align? How well is, some of the things we've talked about before, is how well is the sector as a whole coordinating and working together? Which can have a very big impact on the effectiveness of a peer program. If you think around referrals between services, if you think around if one service is being really discriminatory and stigmatising, that means another service is going to have to pick up all of that issue and they're going to be influx. So that kind of ebb and flow. Adaptation is probably key, particularly in the environment we're going into, in the sense of how the program changes its approach on a constant basis of what's happening in the community. And an influence we split into 2. Usually we only think about influence within community, and often that's, either something between brochures distributed, needles distributed, and changes in knowledge. Okay, and what we're really referring to here is influence in the sense of how the program actually uses the community's existing ways of operating and functioning and the changes that they're going through to actually enhance and influence those sorts of processes. So it's a little bit more about looking at ways that we can get beyond the direct service delivery to the broader influence. At a policy level, it's around how the program achieves or mobilises influence in policy and process outcomes, which are underpinning a lot of the work with peer programs because, particularly these ones, are in such politically sensitive environments. The key thing of those 4 functions, and what's probably more important than the functions themselves, is actually how they relate to each other. So, because it's me, I came up with a diagram with lots of arrows and circles and so forth. People that know me will understand what I mean. So we came down, and this is basically a kind of synthesis of a whole range of system maps to work out, okay, what's really going on so that we can identify what it is that we need to keep our eye on to see if the programs are being effective. And I'll take you through an example more in relation to, say, perhaps the introduction of DAAs and the scaling up that we wanted to do in relation to what Margaret was talking about. So if we think of, say, a peer program it's working by and for people who use drugs, who inject drugs, here we've got the program itself. So, it might be peer service delivery, so it might be an NSP, some broader health promotion, community development, and it might also be peer leadership in the sense of playing an active role with policy, researchers and so forth, all those committees and so forth. Now, it doesn't matter how great the service here is, unless there's a genuine engagement, the community is not actually going to engage and provide this, and actually engage in the service itself. So that's quite critical in the sense it's more of a multiplying relationship rather than additive. So the better the engagement, the more people will actually engage with the service, which also means the more the service is going to understand what's happening in the community and know how to adapt and change. The thing that often gets missed out with a lot of peer programs we found was, while we have critical peer learning in the sense of peers working in the programs, every time they deliver service, every time they're engaging with someone, both the peer worker and the community member are learning from that experience. They're getting a better insight and adapting and so on. What often doesn't happen is the organisation it's based in doesn't necessarily get that learning. And so what we're finding is the organisation itself needs to have the depth of understanding around the community to understand how to support the program to rapidly change. So that's some of the key stuff in adaptation going through. When we get to influence, in here is often what we've been, impact evaluation, those sorts of aspects. What we're really talking about influence includes that. So it's still reach of services, who you're serving and so forth. But it's also about looking at what's the broader changes that are happening in the community itself. The more influence we have within the community, the stronger the engagement's going to be. The stronger the engagement, the better the service, the more, and it goes around. It's one of the reasons why, from a system point of view, what we're looking for is not necessarily these as separate boxes, but we're actually looking at other processes. Are the cycles actually happening in an effective way? For example, it's really hard. Most community organisations aren't going to be able to do big community surveys about changes that are happening in the community. However, if we can predict if the influence down here is effective, what changes would we expect to start seeing in the way the community engages with us? What changes in questions, what changes in issues and so forth? The engagement's also about, are we actually expanding? If we're hearing the same thing all the time from our communities we're working with, and yet we know this community's changing rapidly, then are we actually reaching the community we need to? We think we should be hearing new things all the time. So that's where we started to pull out some indicators. Going the other way, just briefly in sense of influence, is, say with DAAs, we can actually get as much community mobilisation and excitement around people feeling, say injecting drug users feeling confident that they will be welcome and they are part of the scaling up of DAAs and access to treatments. But if the kinds of fears and concerns that are happening right now in the community aren't fed through, then what we can end up with is a health system that actually doesn't match with what the community program's actually saying. We end up with a health system that reinforces myths that people who inject drugs aren't actually up the front, they're at the back of the queue, those sorts of aspects. For peer programs to be effective in the policy system, there's a whole lot of factors. One, there's no doubt that there's still a lot of quite strong stigma and so forth within our own sort of policy and sector systems about the validity of advice coming from the different communities we're working with. But also one of the things is the more a peer program can demonstrate the quality of its engagement, the more persuasive, quality of engagement and how effective they're adapting, the more persuasive that policy and advocacy will be. The more effective that will be, the more alignment we should start to see. Now, for brevity, I've only talked about positive changes, but obviously you can see if any of these start to fall down, then the cycles actually become a negative reinforcing. The key thing in that sense is what it did is it started to get us to think around peer programs not as a sort of, inject people with knowledge, they'll change their behaviour aspect, which we've all known for decades isn't how it works. But actually to think, okay, if we know that's not how it works, what are the sort of indicators we should be looking for? So what we then went through is a process of developing the framework And then with each of the programs, trialling and developing some indicators that are quite specific. So for example, the work we did with WASA and with NAPWA and all the other agency acronyms of organisations we're working with, was, say, for example, for a peer-run needle and syringe program, what does engagement look like? What does adaptation look like? What does influence look like? And then worked out some tools. To give you an idea of what I mean by indicators, I've grabbed a couple here. So, for example, engagement. These are fairly generic. Engagement, the program constantly updates its mental maps and networks and cultures within the community. It works with, you can tell an academic wrote that. Anyway, a couple of the key things, I suppose, is think of the ones I've listed here are more like kind of quality indicators. There's others we developed that had a bit more of a flavour around impact. So they still kind of fit into the evaluations that we're often looking at. But to give an example that I've said before was with engagement, it's about actively thinking, okay, the community's changing, therefore our programs have to change. So engagement is about actively looking for what is the next thing we're going to have to adapt and change. And it's also about planning programs on the assumption that they will change, not changing them if something changes. Okay, and if you think around a kind of contracting and thinking through, it changes that the sort of inference in the framework in which they're set up. So what it means is a program that is constantly changing is seen as a good thing, and a program, perhaps a peer program that's run the same way every year, year in, year out, actually should be a red flag, something to have a look at more deeply, not as a green flag of, gee, it's running really great. Does that make sense? Hang on, go back. Go back. So we went through a whole range of ones. Now, what I've done here is just included one or two, but for each agency, for each function, we came up with sort of 4 or 5 or 3 or 4 or whatever we came up with. And the idea here is that they're not by themselves. They actually kind of flow into each other as the process goes around. And so the key thing with the indicators, I've got copies of that is actually legible and you can read. But it's really that idea of the indicators flow into each other. So what you're looking for is processes. If we think of the kind of cycle approach of multiple cycles impacting each other, if we can't measure one item, maybe if we move along the cycle, there's something else we can. The focus we were doing for the indicators and the tools were things that would give us an indication or an insight that things were operating well, or if things were going off track, that was achievable and sustainable within a CBO, not the kind of thing you would do in a research study to prove things one way or the other. They're all the different couple of the programs we worked with, just to give a sense of some of the different tools we trialled. So what we did do is we trialled tools in bits of programs within an agency. We didn't do anything as a whole organisation. One of the reasons for that was we weren't entirely sure we're doing this right, and we didn't want to stuff up an organisation entirely. Okay? So we just did bits, a bit of a feasibility study first. Throughout that process, as far as I know, no one died. So we will be going on to the next stage. We've been refunded to do some look at this approach as a whole organisation, which is really what it's about. In conclusion, really what I'm looking at is, I suppose, one of the things is, how can we meaningfully enhance our investment in our community programs, particularly at the time that we've now got where things are really trying to scale things up, but we're not really sure how it's going to play out. My feeling is if we focus on some of these 4 key sort of system level functions, I think we'll be able to certainly demonstrate the authenticity and the timeliness of some of the insights we're getting from our programs. And allow the programs themselves to be able to demonstrate that, not only to their communities, but to the sector generally. Adapt to the changes, but certainly influence and add value to the overall approach that we're doing both in the community and within the sector. The challenge that I put also is that if as funders and policymakers and researchers, if we're not actually drawing on and gaining strategic benefit from some of the insights from our community investments, then I would suggest we're not really maximising the types of investments we've got. We're not getting the full value for our money. At a time when we're trying to ramp things up and change things rapidly, that's probably the worst time. I'm doing at least 3 negatives in this statement, aren't I? Yeah, we're not going to get through the next 5-10 years if we don't actually get full benefit from all the parts of the system we're operating in. Yeah, the next step, the aim frame is certainly to support a whole range of things. Fortunately, we have been, I believe, refunded for 3 years, though I haven't seen a signed contract yet, and I know I'm being recorded, but anyway. But we are looking at taking a whole organisation approach to really ramp out and develop tools. There's a lot more on our website, where we'll be uploading everything as we develop it. That's it, yes. Thank you.